alive before we get started, by the way. Okay, I've been prepping. Hopefully it's enough. And yes, I always miss keywords or clues. Good. So hopefully this whole week has been helpful to you. This today is going to be very interesting. It's going to be great. My week has been great. What about you? My week has been great because I've been here doing this stuff and doing this challenge. So like after my 9 to 5, great, because I'm with you guys. Before my 9 to 5 though, ghetto. Ghetto. Grateful, but ghetto. All right. So as we get in and have more people get acclimated, because I'm just now dropping the link. That should let you know how my day has been. All right, but let's. Shania, did you do your day 4 workbook or your clue check-in? Let me just bring in our school stuff. Let me go to our classroom. Okay, perfect. Awesome. All right. So we're going to go ahead and dive into it, get started. I know it's Friday night, so some people are going to come as they can. Some people are just going to catch the replay. Totally fine. So we're going to dive right in. We're going to do, just like we've been doing all week, do our little mini lesson, do our little review of, again, not content, but the strategy. And then we're going to dive into our questions so you can see how to apply that. So, all right. So now we're going to get started. Well, we're going to get started at 7:10. So 2 more minutes. We're going to get started on our presentation and doing our stuff. Okay. And you have drop this link. Tomorrow is actually going to be amazing as well, Shania, because we're putting everything together and we're diving in to like practice questions. So besides like a very light review of, all the clues and the things that we were talking about, that's going to be like the extent of what we're going to do and how we're going to do it. Because after that, we're going to get into practice questions and just dive right into applying that content, everything that you learned. So today we're gonna get started in about 1 more minute. And okay, perfect. Right here. Okay. All right, we're gonna get started. Now we're gonna get started. All right, so it is now 7:10. Welcome, everyone. Hello, my name is Nurse Sam. I'm your host and creator of the NCLEX Clues Challenge. This is the Spot the NCLEX Clues 5-day live challenge that we started on Tuesday to help you spot the hidden clues within the questions so you understand how to answer the questions, what they're actually looking for and wanting you to answer, and how to think like the NCLEX. Okay, so today is day 4. And we're about to dive into our trap answer clues, AKA, are we looking for what's right or what's wrong? And you're going to know exactly what I mean as we get into these slides, okay? All right, so like I said, we are focusing on those tricky wording, the tricky wording of the questions that can make students answer the opposite of what the question's actually asking. All right, now these are what I like to call trap answer clues. So by the end of today's lesson, you should be able to do the following. You should be able to identify the trap wording in the question stem, which there are certain phrases that you need to look out for and know. You need to know what that means. And once you're able to know what that means, you'll be able to identify them. Okay. Then you're going to decide if the question wants the correct or incorrect answer. Okay. So you'll also be able to recognize the teaching and the follow-up clue phrases. Okay. We'll dive more into that. And then finally, you'll be able to avoid picking an answer that sounds familiar, but does not match the STEM or does not match what the question is actually asking for this client. Okay. So let's go ahead and dive into what trap answer clues are. Okay. Again, these are the words or the phrases in the question that tell you what type of answer you're looking for. So sometimes the NCLEX is asking you to find what's right. That's typically the default when you're taking any type of question, practice question, exam question. You're looking for the correct answer. That's just default. All right. Now, on the NCLEX, sometimes it's actually asking you to catch what's wrong or what's unsafe or a misunderstanding, usually of teachings or interventions. Okay. They like to do that by using very specific phrases. Now, these common trap answer clue phrases are listed right here, and they're either going to mean one or two things. These phrases on the left, they're going to usually mean that you're looking for the wrong or the unsafe answer. Okay, usually the STEM will hold phrases like needs further teaching, further instruction is needed. Have you guys seen any of these before? Let me know in the comments if you've seen these phrases before. Requires follow-up, requires intervention, needs correction, indicates a lack of understanding, or just unsafe action. These are the common phrases that you'll typically see riddled in these NCLEX style questions, letting you know that you need to find the incorrect answer for the answer to be correct. And that can be very confusing, right? But we're going to get into how to make that easier for you so you don't get tripped up, right? Now, on the phrases on the right side, those are your default phrases letting you know that you're looking for the correct or the right or safe answer, all right? These indicate understanding, indicates adequate understanding, teaching has been effective, demonstrates correct technique, appropriate action, or expected finding. These are all phrases that let you know that this is expected, this is going according to plan, and it's you're looking for the right answer, which again is the default. Okay. Right. You've seen those, you've seen those phrases. Cool. So the easier you are, or the easier it is for you to identify those phrases, the easier it'll be for you to understand how to answer those questions that use those phrases. Okay. Now, this is why those clues matter. It's going to tell you if you're looking for, again, the correct statement or the incorrect statement. That one phrase can flip the entire question, because usually that phrase is, again, at the end of the question, right when it's telling you the last line where it's telling you what it wants you to answer. That's where they'll slide that in. So the entire question or what you think that you're about to answer can change right when you reach the end of that question stem, which is another reason why it's important to completely read the entire question straight through. Okay. Now, big mistake. Many students know the content, but they answer the opposite question. Okay. You're picking a correct statement when the question asks which statement needs further teaching. Or you're picking an incorrect statement when the question asks which statement indicates understanding. So there's like a mismatch, flip-flop thing that's going on. And we're going to correct that. Okay, here's how you fix that. Do not read the answer choices until you know what the STEM wants. Again, what the STEM wants, especially in these trap answer clues, are going to be held, or you're going to find them at the last sentence of these question stems. All right. Now, before you even get into the answer choices, I always say you need to understand what the question is asking before you read them. Same reigns true for trap answer clues. Okay. Not only do you have to understand, okay, who's my client? What's going on in my scenario? What is the question asking? And then ask yourself, am I looking for what's right? Or am I looking for what's wrong? Okay. And it's usually an action or most commonly a statement. Okay, now these are what these clues mean. Needs further teaching, you're finding the wrong statement. Okay, further instruction is needed, you're finding the misunderstanding. Okay, looking for wrong. Requires follow-up. Find the concerning finding. So you're looking for something that's abnormal. Requires intervention. You're finding the unsafe action. Indicates understanding. Now we're kind of getting on the opposite side. You're finding the correct statement, which is normally default, what you would be doing. Adequate understanding. Again, you're looking for the safe or the correct statement. And then expected finding. You're finding what's normal or anticipated. Okay. So again, before you answer questions that have these stems, these trap answer stems inside of them, you want to ask yourself, what type of answer is this question asking me to find? Again, am I looking for what's correct, what's incorrect, what's safe, what's unsafe, stable, unstable, expected versus unexpected? That's going to let you know what direction you need to go to. Okay, now let's do a practice question that's using this terminology so you can kind of see what I mean. All right, now, this question reads, a nurse provides teaching to a client prescribed warfarin. Which statement by the client indicates a need for further teaching? Now, before we even get into the answer choices, let me know, is this question asking for the correct statement or the incorrect statement? Is this question asking us for the correct or the incorrect statement? And what is it? What phrase is being used in this question to let us know that that's what that is? We're looking for the incorrect statement. Okay. The fact that the answer stem or the question stem is asking for us to choose a statement that indicates a need for further teaching. That is going to be your keyword, your key phrase that lets you know, okay, I'm looking for the wrong or the incorrect answer. Okay. Now, knowing that, all right, we just spotted the trap answer clue, need for further teaching. It lets us know that we're looking for the wrong or the misunderstanding, the statement that shows that there's a misunderstanding. Okay, so now that we know what we're looking for, now we can dive into the answer choices so we can see if each of those apply. Okay. Now, here's another trick that I always recommend doing for these types of questions. Specifically, when you're looking for the incorrect or the false or the wrong answer, you always want to ask yourself at each answer choice, is this right or wrong? So don't just ask yourself for the entire question. For literally each answer choice, ask yourself, is this right or wrong for this situation, this client? Okay. Now go ahead and answer this question. You're looking for the unsafe or statement that is unsafe, because again, you're looking for the statement that indicates a need for further teaching. What's happening with our client? A client is being prescribed warfarin. What kind of medication is warfarin? That's how you kind of want to break it down. Okay, especially with these types of questions. And you're going to see what I mean when we get into more and more, and you start to notice a pattern. Pattern recognition is going to save you every time. All right, so I'm looking, you guys are saying C, which is take aspirin for headaches. So again, we're looking for the statement that's unsafe for a client that's taking warfarin, which is a blood thinner, right? So the answer is C, I will take aspirin for headaches if needed. This statement shows that the client needs further teaching because this is the incorrect statement, hence why this is the correct answer. So warfarin, once again, is a blood thinner. Thins the blood, it increases bleeding risk. Now, of the answer choices, let's specifically talk with focus on C. Aspirin, as does NSAIDs, also increases bleeding risk. It also acts as a blood thinner. So if you have warfarin already that thins your blood, and then you're putting another blood thinner onto it, you're trying to have a skinny blood summer. Okay, the thinnest blood of all. So that, and we know that with an increased or blood thinned or increasingly thin blood, or blood that's really thin, the bleeding risk goes up. We know bleeding risk is a safety concern. All right, remember our ABCs. Circulation, that can lead to a lot of things. Okay, but blood loss, shock, death, all those things. So we don't want to increase bleeding risk. So that's why we would choose this one, because it was the incorrect answer, which means it was the correct answer. All right, anticoagulant. Thank you. All right, so this is why the other ones are incorrect, which is also, in my opinion, just as important. Okay. A, I will use an electric razor when shaving. All right. Now, this was not the answer because this is, once again, a safe statement. This is correct, which made the answer incorrect. Okay. Now, electric razors help reduce bleeding risk versus a straight edge razor. It's, once again, it's very important that you go through the rationales of the incorrect answer as well, because things like little nuggets and treasures like this pop up. So one thing you need to know about bleeding risk and precautions, they love to use, again, the same thing over and over again, especially when it comes to intervention of things that you want to do, things that you don't want to do. All right. Use of a razor is very commonly tested on the NCLEX, and whether or not you know the type of razor to use in certain situations. So here in this answer choice, it says, I will use an electric razor when shaving. All right. Electric razors are safe. They help reduce bleeding risk. Now, if this would have said, I will use a straight edge razor when shaving, it would have changed the entire answer choice, because then that would be incorrect. Okay, so again, make sure you are noting these descriptive words, even in the answer choices, because one small change can change the entire answer choice. All right. Now, B, I will report unusual bleeding or bruising. That's a true statement. You should report that. And then D, I will keep my follow-up labs appointments. Also a true statement, because warfarin requires, I'm so mad it told me. Warfarin requires monitoring of PT-INR. I would ask you other questions. Yeah, I'm going to ask you a follow-up question for warfarin. Yeah, sure. Okay, so right here, just so I know you guys know, it says that warfarin requires blood test monitoring, PT-INR. We know warfarin is an anticoagulant. It increases bleeding risk, all that great stuff. What is the antidote of warfarin? Drop it down in the comments. What is the antidote or the reversal agent of warfarin? Drop that in the comment. Just want to keep you on your toes, make sure you know. All right. So while you guys are telling me that, great job. Vitamin K, vitamin K. That is the reversal agent for warfarin. Great. I just want to make sure you guys knew. All right. Now let's get into our critical thinking chair moment. Sit down in a critical thinking chair and think. I won't do the whole song. Before you choose, you want to ask yourself, is this am I looking for what's right, or am I looking for what's wrong? And that can either be, am I looking for the right intervention? Am I looking for the right action? Am I looking for the right, statement that from teaching? Are you looking for what's right or what's wrong? Whatever that may be. Okay. 2, is this a they understood it question, or is this a they need more teaching question? Goes this follow-up question to the right or wrong. Okay. And then finally, does my answer actually match what's being asked specifically about this client? Okay. That's why I always say, in addition to you knowing what the STEM is asking and being able to identify if you're looking for the right answer or the wrong answer, you also need to know what you're looking for these answers about. So it's very important that you know and don't skip over the situation, the scenario, or the diagnosis from the client. Okay. All right. Now, for those of you that are in camp nursing school, have you done your day 4 check-in? Shania, I know I asked you, but everyone else, let me know down below if you've done your day 4 check-in. Let me go into my share screen so we can kind of go through that together. What day is it? This one. Day 4. Okay, cool. Can you guys see my screen? Perfect. All right, you guys know after you get into camp nursing school and you go into the classroom, the NCLEX Clues Challenge Classroom is going to be the second one right there. You're going to click that. This is all your housekeeping things, what to expect, all your details. And then as far as our daily mini lessons and the activities, it's going to be right in here. So we're on day 4. All right. We just kind of went over a more in-depth version of this kind of like overview. This is where your clue check-in is for your day 4. All right. So after you click on that, just a few little questions to help get you warmed up for today's lesson so you can understand kind of what we're about to dive into. Where are we? Boom, right here. Oh, you don't even see what I'm showing you. One second. Right here. Boom. So this is our day 4 check-in. All right, right or wrong. So have you guys done this, Shania? I already know that you have done it. Let me know again in the comments if you have already done your clue check-in. If you have not, please do so. That's how you get your points for the overall challenge. The more check-ins you do, the more points you get in addition to participating. So let's go ahead and dive into the questions here. Again, these are like quick little questions to help you solidify your understanding of what we're going to be teaching and learning today. So the first question is needs further teaching. This means I'm looking for the correct statement or the incorrect statement. Let me know. Needs for further teaching. What statement are you looking for, right or wrong? All right, I will. That's okay. You have time. The challenge ends tomorrow, so any day, whatever check-in that you haven't done, you still have until tomorrow, the end of tomorrow, to do that, especially because it's the weekend. All right. So need for further teaching, that means you're looking for what answer or what statement? The correct statement or the incorrect statement? Let me know in the comments below. What statement are you looking for? Sit back in and think and share and think. Go ahead and comment your answer. Think. All right, you're looking for the incorrect or the wrong statement. Absolutely. Needs for further teaching. Now, let's go to the next one. Teaching has been effective. This means that you're looking for what? The correct or the wrong statement. Teaching has been effective. Is that correct or incorrect? Teaching has been effective is the correct. You're looking for the correct statement. The correct one. Great job. And then requires intervention. That means you're looking for something that's safe or something that's unsafe. If something requires intervention. If something requires intervention, are you looking for what's safe or something unsafe / incorrect? If it requires intervention, you're looking for something unsafe because it requires you to intervene. Right. And then for this one, we're going to pick the trap answer STEM clue. Okay, which statement by the client indicates an adequate understanding? Okay, we're looking for the trap answer STEM clue that lets us know what type of answer we're looking for. So what would be the clue in this sentence? Which statement by the client indicates an adequate understanding? Which one? Which statement about the client indicates an adequate understanding? It's adequate understanding. Great job. Okay. So we just kind of went through your day 4 clue check-in. So whenever you get a chance between now, or not now, but between today and tomorrow, go ahead and do it. Especially because we just went through it. That's how you get your points. Okay. All right. Perfect. I feel like everyone here knows that. Okay, perfect. All right. Now, here's your final takeaway before we dive in to the greatness of these questions. Your final takeaway before you choose an answer, you always want to pause and ask yourself, in addition to what is the NCLEX asking me, right? Is the NCLEX asking me to find what's right or what's wrong? That specific clue can change the entire answer. Okay. All right. Now we're going to dive into our trap answers. Trap answer practice. Are you guys ready to just go ahead and dive into some practice questions so you can see specifically what I mean and how to answer? Give me a thumbs up in the comments if you are ready to get started with our trap answer clues questions. Are you ready? Ready. All right, let's go ahead and dive in. Perfect. All right. You guys know at the start of our questions, we do our dance break. Well, so here, wait. We just got a question. We just got a question. We just got a question. Let's go get it right. Okay, now let's go. The nurse is providing instructions regarding home care measures to a client with diabetes mellitus and instructs the client about the causes of hypoglycemia. The nurse determines that additional instruction is needed if the client identifies which as a cause of hypoglycemia. 1, omitted meals. 2, increased intensity of activity. 3, decreased daily insulin dosage. Or 4, inadequate amount of fluid intake. You're definitely going, yeah, I'm just going to let y'all answer. Go ahead and drop your answer in the comments. What do you think this answer is? I see C. I see 3. Okay, go ahead. Defend your answer. What is it about? First of all, are we looking for the right answer, the wrong answer? Okay. The question lets us know about our client. Yeah, it does. Okay. Wait, no, go back. The question lets us know about our client. Someone's diabetes mellitus. And this looks like a teaching question, obviously, because we're teaching about the instructions or the causes of hypoglycemia, which is low blood sugar. So we're looking for, is if additional instruction is needed, we're looking for the wrong statement or the wrong answer of this question. Okay, so let me see what you say is good. Our answer. The answer, yes, is 3, decrease daily insulin dosage. We're going to break it down. But yes, you guys are absolutely correct. Everyone that said 3 or C, correct. Shania said, if the patient has diabetes and they're decreasing insulin, it may lead to hyperglycemia, not hypo. We're looking for the wrong answer. That was a perfect breakdown. Perfect breakdown. That's exactly how I want you guys to think about it. Okay. That's great from a content standpoint and a strategy standpoint. Okay. Obviously, like I said, you're going to need both content and strategy to pass the NCLEX, because you're going to need to base that strategy off of your knowledge of the content. Right. And in this case, that was the perfect way to do that. All right. From a strategy standpoint, what I do want to just point out to you guys so you can kind of be aware of it and know. Remember, we were talking about all the clues from all the days. When we were talking about, what was it, day 2, descriptive word clues, and how whenever, especially in answer choices, whenever you see these specific words, increased, decreased, things like that, where there's a clear opposite, always just take note and just make sure that you're not either going too fast, or if you have a really good understanding, grasp of what the question's asking, because usually it'll be the word like an increase, decreased, or whatever. That's the key word in the answer choice. Okay, so in this case, decrease daily insulin dosage, you wouldn't decrease. You would actually I was going to say right here, it would be an increase as far as the cause. So decreasing the dose of insulin will lead to hyperglycemia or high blood sugar, which is exactly what Shania said. And then the causes of hypoglycemic reactions or low blood sugar reactions: you wait too long to eat or delayed consumption of meals, and either not eating enough or lack of the necessary amounts of food. That can cause a hypoglycemic reaction. In addition to excessive insulin, because what do we know about insulin? Does insulin raise your blood sugar or does it lower your blood sugar? Does insulin raise or lower your blood sugar? Let me know in the comments. Does insulin raise or lower your blood sugar? Insulin lowers, right? Right. Exactly. Insulin lowers. So if a cause of low blood sugar would be excessive insulin, the thing that lowers it. So yes. Another thing that they said, vomiting associated with illness, strenuous exercise. This whole strenuous exercise, which may potentiate the action of insulin, very important to know. I know it was listed as a choice in this question, and it wasn't the answer, and B wasn't related to the question. I won't say related to the question. It was not the answer to the question, but take note of that. Okay. The NCLEX loves to use the whole strenuous exercise thing and that effect on the blood sugar. They love to use that as well as illness. So they said it here in the rationale for a reason, because they want you to take note of it. All right. And then, yeah, the fluid that can lead to dehydration, but not low blood sugar. All right. Next one, I will skip the song. Man, it's got a question. I'll skip the song. Number 2, a client with acquired immunodeficiency syndrome, AIDS, has a respiratory infection from pneumocystis jirovecii, and has been experiencing difficulty breathing and resultant problems with gas exchange. Which finding indicates that the expected outcome of care has yet to be achieved? The way they word that, I would have chuckled audibly like I just did. 1, the client limits fluid intake. 2, the client has clear breath sounds. 3, the client expectorates secretions easily. Or 4, the client is the client is free of complaints of shortness of breath. What is our answer? Well, I'm seeing fours. Okay, let's get back to the question. All right, the last line, it's saying which finding indicates that the expected outcome of care for our client who has AIDS and a respiratory infection and is experiencing difficulty breathing. What's the expected outcome of care that has yet to be achieved? Right, so, I see it too. You changed your answer? All right, tell me why you guys said the answer that you said before we get into the rationale. Very important. Comment down below why you chose your answer. It may seem redundant, but again, this is active recall at best. This is helping you retain longer, and it's actually helping you understand and be able to recall the information quicker as well. Okay. So Katrina, tell me why you changed your answer from 4 to 2. And then everyone else that said 4, tell me why you said your answer. And while you guys are commenting, let's see what that answer is. Answer is 1. Hold on. A client with acquired, wait, no. 1, the client limits fluid intake. Okay, which finding indicates that the expected outcome of care has yet to be achieved? Okay, yes. The answer is 1. So it says the status. Oh, okay. This is the way it was worded. I know. Even I was confused. Even I was confused. No, really, I was confused. So the one I eliminated first. Okay. Again, it's the way that they worded the question. The way they worded the question. Okay, let's go back to it. Which finding indicates that the expected outcome of care has yet to be achieved? Okay. So we are looking for the answer that does not reflect a therapeutic outcome. Okay. One makes no sense. All right. So it says the status of the client with a problem concerning gas exchange. Notice the whole pneumonia thing. Yes, it's bad. It lets us know it's a common opportunistic infection. But the fact that this, I'm not even going to say that part. The status of the client with a problem concerning gas exchange would be evaluated against the standard outcome criteria for a P. Girovechi infection. Okay. So again, you're looking for, especially with that gas exchange problem, these options would include 2, 3, and 4, where the breath sounds are clear. That is a warranted outcome or a therapeutic outcome that you want. The nurse knows that the secretions that are being coughed up effectively, right? And the client states that breathing is easier. The client would not limit fluid intake because, again, if you do not, usually they're saying encourage fluids to thin out the secretions. So not encouraging those fluids or limiting those fluids would actually make it even harder for those secretions to come out, which would be the finding that indicates the outcome of care has yet to be achieved. Yeah, you were looking for the wrong answer. You see why practice is so important? Because first of all, who words it like that? I read that so wrong. I know. It's right here. Mm-hmm. I know. The way that they worded it was so crazy. But yeah, which finding indicates that the expected outcome of care has yet to be achieved. You see what I laughed when I read it before? Yeah. So the client limits fluid intake. You guys understand why? It is what it is. I just want to make sure we all understand. The finding that indicates that the expected outcome of care has yet to be achieved. You would not expect thin fluids. I'm not thin fluids. You would not expect like a clear cough. You would not expect that phlegm to be coughed up easily, which is one of the outcomes of cares for someone with this type of pneumonia. They would not achieve that with a limited fluid intake. Yes, it has yet to be achieved. Okay. All right. Let's dive into it again. It's better when you have practice. Just the more you do, the better and the easier it'll be. I know. I didn't like it either, which is why I put it in there, because the more people that don't like it, the more the NCLEX is like, well, we'll put in 3 of them. The nurse is providing home care instructions to a client after a rhinoplasty. Which statement by the client indicates a need for further instruction? 1, I need to sleep on 2 pillows to elevate my head. 2, I would avoid any activities such as bending over. 3, I need to be sure to run. Sorry, I gotta grow up. I need to be sure to run a dehumidifier in my home. Or 4, I need to sneeze through the mouth and not blow through the nose. Which statement by the client indicates a need for further instruction? Let's look at our client. What's going on with our client? All right. They're post rhinoplasty. Nose job. Okay, so we're looking for the statement. Are we looking for the right or wrong statement? If we're looking for the statement that indicates the need for further teaching, are we looking for the right or the wrong statement about post-op or home care instructions for a client that's fresh, with a fresh nose job? Remini says 3 with a question mark. That last one really shook you, Remix. Because you usually don't respond back with question marks after an answer. You know how I feel about those question marks. You're going to submit an answer, stand on it, 10 toes. All right, so I'm seeing 3s and seeing 4s. All right, need for further instruction, you're looking for the wrong answer. So which of these is the wrong statement made about home care instructions for a client that's fresh after a nose job? And the answer is, it's 3. I need to be sure to run a dehumidifier in my home. It's 3. It's 3. It's 3. All right. So great job. Great job, Ramnik. Great job, Shania. Katrina, you were close. You said I had to sneeze through my mouth and not blow through my nose. All right. Let's dive into the rationales. Okay. With these type of questions, I always say, always read the rationale. Very important. With these types of questions, definitely read the rationale. Okay. Definitely. Because besides understanding like, okay, right versus wrong statement strategy wise, that's like the extent of it. The rest, you're going to have to rely on content. And a lot of these things are so specific to like the actions and interventions of these specific disorders. You may or may not know them. So the rationale is always going to get you together and get you right. So let's get into it. So again, after rhinoplasty, nose job, the client is taught to sleep on at least 2 pillows. Remember, descriptive words can also be numbers. If this would have said 1 pillow, the entire answer choice would have been changed. Should I say I was so close to changing my answer? This elevates the head and reduces edema. Right. These are very tricky. That's what I said, the wording. It's not that you don't know the content, it's the strategy. It's the way that they word these questions. Practice makes progress, I promise you. The more we do, which is why today and tomorrow is going to be so tea. Yeah. So again, rhinoplasty, 2 pillows. All right. Think about, I don't know. You have 2 nostrils, you need 2 pillows. The client, again, and that's to reduce edema. That's why. It's not just for comfort. There's a reason behind it. The client also is told to avoid any activities such as bending over that would increase intracranial pressure and cause nasal bleeding. I can go so many places with that, but I choose not to. I choose to just, say that maybe this client can't be outside this summer. And I hate that for you. I'm so sorry. But yes, no bending over. That would increase intracranial pressure and cause nasal bleeding. So I'm sorry, no dancing for you. A humidifier, not a dehumidifier. Do y'all see that? Humidifier, not dehumidifier. You see how that one word, oof, now that decreases the dry throat associated with the mouth breathing. And then the client needs to be instructed to sneeze through the mouth and not blow through the nose. I have a question. How do you sneeze through the mouth? No, really. I'll Google that later. How do you sneeze through the mouth? Anyway, great job. I was over here questioning if there's a difference between humidifier and dehumidifier, just questioning everything. Yep. All right. Next question. Don't you just love these little trick or treats that the NCLEX is giving you? It is May. All right. And it's giving you trick or treat energy. That's why I call them the trap answer clues. Like, I know how you sneeze through. Was that an accident, Shania? I'm going to Google it later. All right. So the nurse has provided discharge instructions to a client who underwent a right mastectomy with axillary lymph node dissection. Which statement made by the client indicates a need for further instruction regarding home care measures? First things first, based off of the clue that they gave us in the STEM, are we looking for the right answer or the wrong answer? Drop it in the comments. All right. Again, let's get a clear understanding of the client, the situation, and the question STEM before we even get into the answer choices. What's going on with the client? They underwent a right mastectomy. Descriptive words, everyone. Descriptive words. Directions also matter. Okay, they underwent a right mastectomy with axillary lymph node dissection. Okay, we're looking for the wrong statement regarding home care about that right mastectomy with lymph node dissection. Okay, 1, it is all right to use a straight razor to shave under my arms. Is that a right or wrong statement about a right mastectomy with axillary lymph node dissection? Is that right or wrong? 2, I must be sure to use thick pot holders when I'm cooking. Is that right or wrong regarding a right mastectomy with axillary lymph node dissection? 3, I must be sure not to have blood pressures taken or blood drawn from my right arm. Is that right or wrong regarding our client with a right mastectomy, having gone through a right mastectomy with axillary lymph node dissection? And then 4, I need to inform all of my other healthcare providers that I have had this surgical procedure. Is that right or wrong regarding being post right mastectomy with axillary lymph node dissection? You guys are saying, I'm saying one. Tell me why. We're looking for the wrong answer. So you guys are saying the statement, it is all right to use a straight razor to shave under my arms. You're saying that that's wrong? Let's look and see. Correct. You're correct that this is incorrect. Great job. Great job. So remember, this is why I always say, make sure you're paying attention to the specific client, the specific situation that's going on. All right. After mastectomy with axillary lymph node dissection, the client's at risk for arm edema, lymphedema, and infection. Okay. The client needs to be instructed regarding home care measures to prevent these complications. The client needs to be told to avoid activities such as carrying heavy objects or having blood pressure measurements taken on the affected arm. Great job for you guys not choosing that one, because a lot of people would instantly go that way, because that would be the correct answer, but you were looking for the incorrect. You guys knew that, so period. Great job. The client also needs to be instructed in the techniques to avoid trauma to the affected arm, such as using an electric razor to shave under the arms. Also use gloves when working in the garden, and using or wearing thick pot holders when cooking. So it's less about the bleeding risk, but actually, no, I take that back. I take that back. The bleeding risk is from, I guess, the trauma that they're trying to avoid, especially with that affected arm specifically. So yes. Question. If we're avoiding trauma to that affected arm, I'm gonna ask you two different questions. Okay. If we are instructing them to avoid trauma into the affected arm, could they use a straight edge razor? If they're avoiding trauma to the affected arm, which is the right arm, such as using an electric razor to shape under the arms, could we use a straight edge razor? Let me know. Is it all right to use a, well, obviously not, never mind. This says straight edge. You would use, never mind, I just answered my own question. My fault. It literally just said it. Yes, you would use, remember, anytime you see electric razor or just a razor period, whether it says electric or straight edge, I just need you to keep both of those in mind, especially when it comes to bleeding risk. Because when you see one, they may or may not be referring to the other. That's funny. Ramnique used to say that further teaching questions were her favorite. They're not anymore. Let's get into this other question. The clinic nurse instructs parents of a child with sickle cell anemia about the precipitating factors related to sickle cell crisis, which, if identified by the parent as a precipitating factor, indicates the need for further instruction. So again, are we looking for what's right or are we looking for what's wrong? Are we looking for what's right or what's wrong? Oh no, it does. We're looking for which of these precipitating factors for a child with sickle cell anemia, which of these would indicate a need for further teaching? Stress, we're looking for the wrong one. So stress, fluid overload, infection, trauma. We're looking for the wrong of this list. We're looking for the one that is not or a precipitating factor to sickle cell. Which one is not a precipitating factor to sickle cell? That's what this question is asking you. Once you rephrase it and understand what it's asking you about what and what you need to answer, that's what it comes down to. All right, I'm seeing 2. I see a 3. I see a 2. I see a 2. Let's see what our answer is. And it is 2. Fluid overload. Fluid overload. All right, let's dive into the rationale. Now, sickle cell crises, those are acute exacerbations of sickle cell anemia, and which vary considerably in the severity and frequency. Okay, now those include vaso-occlusive crisis, splenic sequestration, hyperhemolytic crisis, and aplastic crisis. Anytime you see the word crisis after something, especially, I mean, just period in general, it's pretty bad. But you always want to think, again, safety, priority. This is just bad. So how can you avoid this? from happening. In this case, it'll say it in the last line. But sickle cell crisis, it may be precipitated, which basically means it can be brought on by an infection, dehydration, hypoxia, low oxygen, trauma, or physical or emotional stress. Side note, related but not really related. This is me gossiping, but keeping it you like spilling the tea, but keeping it like on brand. I had a friend in, I think it was in high school, who went into, we didn't know she had sickle cell anemia, but we found out then. She went into sickle cell crisis because she found out her boyfriend was cheating on her with one of the cheerleaders and she was out of school for like a week, in the hospital like for like a week, and it was literally because of the emotional stress of seeing her boyfriend kiss the lady from, or the girl from the cheerleading squad behind the bleachers, and it was just very scandalous. But that was my first introduction into a sickle cell crisis. That story is now I'm so sorry to her. She's okay now and she's married with kids, but yeah, really bad. Now, the parents of a child with sickle cell disease would encourage fluid intake of 1.5 to 2 times the daily requirement to prevent dehydration. Do you think I added that just because? No, the NCLEX added that, actually. Or I should say the book that I got this question from, Saunders, shout out to Saunders, they added this little nugget. Whenever they add, again, specific scenarios, measurements, little facts like this, take note of it, okay? You'll probably see it again. Okay. Next question. It said, fluids are crucial in sickle cell. Thank you so much for saying that, Shania. You need to know that. All right. So no dehydration, and know how to specifically how to tell them to encourage the fluids, especially for a child. Okay. Next question. Now let's kind of shift gears. Okay, we just did a whole lot of wrong statements, indicates understanding, need for further teaching. We just did a whole bunch of those. Let's kind of switch it into the right statement, right? This says the nurse has provided dietary instructions to a client with coronary artery disease. Which statement by the client indicates an understanding of the dietary instructions? 1, I'll need to become a strict vegetarian. 2, I should use polyunsaturated oils in my diet. 3, I need to substitute eggs and whole milk for meat. Or 4, I should eliminate all cholesterol and fat from my diet. What is our answer? Again, let's go back to the question so we can understand what it's asking. We're looking for the statement by the client, who, by the way, has coronary artery disease. We're looking for the statement that indicates an understanding. So are we looking for the right statement, or are we looking for the wrong statement of the dietary instructions for coronary artery disease? You're just saying 2, which is I should use polyunsaturated oils in my diet. 2. All right, let's see what our answer is. And it's 2. Great job. We're looking for the correct statement. The statement says that we're looking, which statement by the client indicates an understanding. So if they have an understanding, they're going to say something that's correct, right? So we're looking for the correct statement. And in this case, it was 2. Clients with coronary artery disease. This is why I said it's important for you to do 2 things. And before you get to the answer choices and before you choose an answer. The first thing is to obviously understand what the question's asking you. What are you looking for? Right answer, wrong answer. What's that last line of the question? And then what are they asking that about? So always note like I said, the diagnosis, the situation, usually the diagnosis, because that's where your content is going to come into play. All right. Identifying if you're looking for the wrong or the right statement, that's your strategy. But again, you need both. In these types of questions, you do need a good understanding of both. Okay. So we're looking for the right statement about the diet, the expected the expected diet of a client with coronary artery disease. And we know about that diet. Coronary artery disease clients need to avoid foods that are high in saturated fat and cholesterol. Those foods are like eggs, whole milk, and red meat. You want to stay away from those, avoid those. All right. And then it says these foods also increases the low density lipoproteins, LDLs. You guys remember when we weren't talking about lab values, but do you remember when you probably learned about lab values, specifically about like cholesterol, LDL, HDL? Is LDL the good cholesterol or the bad cholesterol? Little content comprehension check. Is the LDL the good cholesterol or the bad cholesterol? Let me know down below. Okay. And then it says the use of polyunsaturated oils is recommended to control hypercholesterolemia. So increased cholesterol in the blood. And yes, LDL or low density lipoproteins, those are bad. Those are the bad. That's the bad cholesterol. Okay. And then it says it's not necessary to eliminate all cholesterol and fat from the diet. Okay. Strategy wise, this answer should have been eliminated because it has an absolute in there. NCLEX is not like absolutes. I mean, really, who likes absolutes? We say absolutes when we're being dramatic. I personally love a good dramatic absolute. I'm like, I'll never do this again. You never do this for me. And they did it like last week or something. No one loves an absolute because it's usually dramatic. The NCLEX agrees. I should eliminate all cholesterol and fat from my diet. They're probably like, calm down. Like, we didn't say, just decrease it and keep it cute. Like, you don't have to eliminate everything from your diet. So yes, we do not like absolutes. 4 could have been eliminated. And then it's also not necessary to become a strict vegetarian. Again, also dramatic. All right. HCL is happy good. Great job. Next question. The nurse is assisting in administering immunizations as well as providing education to the clients who receive them at a healthcare clinic. Which statement by a client indicates the teaching was successful? Off rip, are we looking for the right answer or the wrong answer? We're looking for right or wrong. What is our answer? Which statement by a client indicates that the teaching was successful? All right. Look at our client, look at our situation, what's going on. Situations, we have a nurse that's administering immunizations and also providing education to the clients who receive them. Okay, so we're doing some teaching about immunizations. That's the situation that's being had. So immunizations is going to be the key player here. Okay, so we're looking for teaching, the correct teaching, right, about immunizations. Let me see what you guys are saying. 4, and the answer is 4. Great job. Immunizations are a way to acquire immunity to a specific disease. This is the correct answer. All right. Breaking down why it's correct and why the other ones are incorrect. Acquired immunity is immunity that can occur by acquiring, right? Let the name help you. Let words mean things, let them help you. Okay, so your acquired immunity is immunity that occurs by being received or acquired that causes antibodies to a specific pathogen to form. Okay. Again, no immunization protects the client from all diseases. You see what I mean about the dramatics and the absolutes? Number one should have been eliminated. Immunizations protect against all diseases. No one likes a dramatic absolute. Okay. Natural innate immunity that's present at birth. That whole natural, you naturally had it, like you were born with it. That's an innate immunity. Okay. Um, okay, great. Perfect. Again, it's very important that you understand the rationale in these types of questions when you're practicing them, because just as easily as we had a question where you were looking for the right statement, they could have easily said, okay, now choose the wrong statement, and then like switched up some of the keywords and the answer choices to then reverse the question and have a totally different answer. Okay, so always make sure you're paying attention to the rationale, because what wasn't the answer very well could be with one change of a word. Okay. Number 7, the nurse is caring for a client with a diagnosis of celiac disease. The nurse recognizes that client teaching has been effective when the client makes which statement? Again, are we looking for the right statement or the wrong statement about our client with celiac disease? Okay. 1, I can eat whatever I want. 2, I will eat rice cereal for breakfast. 3, I will eat beef barley soup for lunch. Or 4, I will eat only wheat bread for a snack. Shania says 2, and that we are looking for the right answer. Remember the question, break it down. We're looking for um, the statement that is correct about celiac disease. Specifically, I guess, the diet of a client with celiac disease. What's right? So I can eat whatever I want. Is that correct with someone with celiac disease? 2, I will eat rice cereal for breakfast. Is that correct or wrong? If so, why? 3, I will eat beef barley soup for lunch. What is beef barley soup? And then 4, I will eat only wheat bread for lunch. You guys are saying 2. Why are you saying 2? What is it about the other ones where you're saying, no, it's not that? And yes, the answer is 2. I will eat rice cereal for breakfast. Is there anything else on the menu? Like, it doesn't have to be this, but dang, anything else? Very, very short rationale. With celiac disease, content wise, you need to know that they have to avoid gluten. What is gluten? Wheat, barley, oats, and rye. I don't know what it is about that question, but as simple as, or this type of like topic, but as simple as that may seem, the NCLEX has a way of wording, just as you've seen before. They have a way of wording questions about celiac disease and the diet so specifically that's like, what? Listing like the diet options or the food options, they'd be like, oh, this patient has celiac disease. Which menu item is something that would be appropriate? And the way and the types of foods, you'd be like, who came up with this menu? And like these aren't real choices. Some of them are. But yes, celiac disease, avoid gluten. What's gluten? Wheat, barley, oats, and rye. Okay. Gluten free. Correct. Correct. Okay. 2 things. Wait for it. Oh. Now let's get into, oh, really good, the brow diet. What does brow stand for? All right. Let's go to our day 4 workbook page. Within your NCLEX, your handy dandy NCLEX Clues workbook, again, that is linked in Camp Nursing School. This is our day 4. Again, this is going to have another kind of quick little overview of all the content that you need to kind of know, what you need to be aware of when you're looking and trying to be aware of the phrases that trap answer clues and questions that the NCLEX loves to use. So this is another kind of like quick snapshot so you can kind of see those commonly used phrases. And then let's do this question. This is the practice question within the workbook. Let's do it together. Okay. An ambulatory care nurse measures the blood pressure of a client and finds it to be 156/94 millimeters of mercury. Which statement indicates that the client needs additional education? 1, it is important that I limit protein intake. 2, I need to maintain a regular exercise program. 3, I understand that I need to avoid adding salt to foods. Or 4, it is important that I begin reducing and then maintaining weight. What do you think our answer is? And this has a step-by-step kind of a breakdown of how you need to approach these types of questions. So step 1, again, is the question asking you for the right statement or the wrong statement? Based off of the STEM. The STEM is which statement indicates that the client needs additional education. So based on that, we're looking for the wrong statement. Okay. And the phrase that lets us know that is additional or needs additional education. Okay, you guys are choosing 1, which is it is important that I limit protein intake. Everyone's saying 1. And then step 4 is why did you choose that answer? Besides the fact that that is the wrong statement, why is it wrong? Why is it wrong with this patient? What's going on with this patient or this client, I should say? Blood pressure of 156/94. Remember how I say whenever you have these questions, look at the diagnosis or the situation? In this case, they didn't give us a diagnosis. They gave us assessment findings. In this case, the assessment finding was 156/94 blood pressure. So now we have to interpret this. Even though we can't diagnose, we can see a symptom and receive a symptom or assess a symptom, I should say, or finding, and be able to intervene based off of that within our scope. So based off of a BP of 156/94, is that normal? Is that abnormal? That's high, right? That's kind of like, we can't say this patient has hypertension because we don't know. However, this is a high blood pressure. This is definitely high. Now, with that though, let me see what you guys are saying. You need to limit protein for hypertension. So even though we can't diagnose the condition of hypertension, we can clearly interpret a BP of 156/94 as being hypertensive. This is a high blood pressure. Okay. And there are things that we can do or educate patients about to have them manage their blood pressure, right? In this case, it's usually like avoiding salts. It's again, maintaining regular exercise. So two is correct. Two is something you would want to do. No, one is not something that you would normally do or see. When you think about limiting protein, actually, I don't even. Yeah, you don't limit protein. Protein's not the thing that you limit, right? You would limit salt normally, or like fats or something. But in this case, salt. I understand that I need to avoid adding salt to foods. That's a correct statement, right? 4, it is important that I begin reducing and then maintaining weight. That's also correct thing. But again, we're looking for the incorrect answer. Hence, 1 is definitely the answer. That is how you get there systematically, step by step. You guys got there, boom, like that. But again, just in case you come across a question to where maybe you do need to break it down because the way that they're wording it is very tricky, like the one we, came across. Maybe we need to rephrase it, break it down just like this so we can kind of understand we don't move too fast and choose the correct answer. So while this may seem like very I can't like redundant to you guys because you guys are such pros, this checklist and this step-by-step kind of like breakdown is always there to use whenever you may need like a boost, whenever you may need like, okay, let me systematically go through this slower, step by step, so I don't miss it. It's always there. Okay. Okay. So that is the last question for tonight. And that completes day 4 of our clues. So that means you guys have learned all of the main clues, right? The main topics of clues that you need to learn for this 5-day challenge. And tomorrow is going to be very special and exciting because we are going to do nothing but do questions, practice questions together in that systematic way, utilizing all the different clues that we learned throughout this week of this challenge. Okay. Before we even kind of like get into that, I want to see how you guys feel. For those that have been, and I believe all of you have been consistent with me. You guys have been here through every day of this challenge. How do you feel now that you're coming on the almost 5th day? You've learned all the clues. Do you feel like you have a better grasp of how to answer NCLEX style questions? Do you feel like there's a little bit more clarity that you have now than before you started this challenge or when you first started this challenge? Let me know how you feel. I'm checking with how you feel now. Let me know in the comments. Shania said, I feel way better. And you have your NCLEX on Tuesday. So hopefully, well, not hopefully, I know you are going to come back with great news. And I'm going to be checking on you before, during, and after. Tani said, yes. Ramnik, why you said you're sad? Why are you sad? But I'm glad you guys have learned something so far. Again, I made this entire challenge because I want to focus every day on things that I noticed a lot of people struggle with more so than the other things. And if we just take time to acknowledge each one of those individual things in a fun way, like this challenge, it would be a good way for it to kind of like click and not feel so overwhelming. And that was the whole purpose behind this. Shania said, what do you do if you come on a question where you truly don't know the content? And that happens. That definitely happens. That's when you definitely have to rely on strategy, which is why a lot of this entire challenge was strategy based, not content based. Okay. I know tomorrow's the last day. Reminique, you're sad because tomorrow's the last day. I know. But I'm excited for tomorrow because it feels like, I don't know, it just feels like it's not, I don't want you to think of it as like a final exam type thing, but it is very cumulative. It's going to be, think of it as like a final party. Think of it like that, right? But Shania, when you don't know the content, that's when you switch into strategy. Whatever strategy applies to that question, right? That's why I say always understand what the question is looking for, or asking you to answer, because then you'll be able to decide on which strategy you need to go towards. Like if you completely don't know the content, whether that's like not even a clue, that's when you have to again rely on strategy and you go to the answer choices to see what you can eliminate. Okay. Whether you have multiple choice, or that's why I say it depends on the type of question, but majority of the answers in, or the question types on the NCLEX are multiple choice. You can also have some select or apply extended multiple choice as well, but majority is going to be multiple choice. And the good thing about multiple choice is that obviously there's one answer. So you get to, you're able to eliminate, usually there's one where you're like, okay, I definitely can eliminate that one. And then the other answers, there's one that's correct, obviously. And then the other two answers, they're going to be, you have to pay attention to those. Okay, that's where you have to use your strategy to see if they're like, okay, are these opposites of anything? Do they have words in the question answer choices that are words that have opposites, or descriptive words like increase, decreased, high, low, hyper, hypo, off, on, severe, moderate, those things like that. You have to take a look at all these individual things and all these clues to see if those exist, and if they do, take a look at it from a different kind of like lens. Okay, and that's if you do not know content at all. Let me see if I can find an example. All right. Well, actually, we'll do examples tomorrow, definitely. But you'll definitely find a lot of that on like with pharmacology, because you don't know and you won't know every medication ever. So if you struggle with pharm, if you're worried about pharm, expect to see a medication. Listen to me. Expect to see a medication that you have never seen before. Expect it as at least one. Expect it. So that's a perfect example of what I mean by then you're gonna have to follow on strategy. Deduce what you can and give it your best go. Because realistically, in real life, you're not going to know what happens off bat with every situation that you come across clinically. It's not going to be that clear. You're not going to, every case that comes in, you're not going to know it off the top of your head. And that's why on the NCLEX, they give you those situations, because it's true. It's mimicking real life. So don't think it's a you thing. I haven't studied enough. No, that's just a life thing. You're not going to know everything. You have to then learn, like you would in real life, what you can then do and gather based off of what you do know, right? I've been doing practice questions and I struggle with those bow tie questions. See, that's a item style strategy. Don't freak out too much about those bow tie questions, because I know people that were freaking out about bow tie questions. They had not one on their NCLEX. They had not one bow tie style question on their NCLEX. I'm not saying you won't, but if you are freaking out about bow tie questions, just practice more of them, and you can do what you do. You can only do what you can do. Because statistically, and this is just statistically, if you were to get every single bow tie question that you were to get, like the maximum amount of bow tie questions that you can get, if you were to get every single one of them wrong, it still would not be like, oh, you definitely failed. You see what I mean? Like, just statistically, you're not even going to get that many, if you even get any. Me personally, I would not stress about the bow tie questions. I would definitely focus more on the majority of the test. And that's how and what I always suggest and recommend to any nursing student that is about to take the NCLEX. There's certain things that is just, you're just not going to know or not going to feel comfortable with. it's up to you to decide, like, okay, I'm not going to put my energy into that. I'm going to put my energy towards something that maybe statistically I know I'm going to get more of, and I don't feel confident like with this. Maybe, I don't know. I can't even put it an example. It could be anything. But to answer your question, girl, do not trip out with these bow ties. Ramney just said she didn't. And then once you figure out the middle piece of these processes, then you can get the interventions in the other pieces. Okay, cool. Perfect. All right. So does anyone have any other questions for tonight? Again, tomorrow is day 5, our last day. And thank goodness I don't have to work throughout the day. So I'm excited about being able to like hype it up all day. I'm so excited. I said, okay, well, that makes me feel better. Good. It should. It should. A lot of, like I said, a lot of the NCLEX is mind games. Not even mind games. It's your mindset. Sorry, not mind games, but your mindset. And just knowing about the test. If you know about the test, certain fears, you're just like, oh, it's fine. Oh, okay. When I went through the NCLEX test plan and I realized that what I was worried about would very rarely be like asked, I didn't even think twice about it. I was like, oh, okay, I'm going to delete that from my mental load and replace it with something else. Okay. All right. So if no one else has any questions, I will see you guys tomorrow at 7 p.m. Wait, let me put tomorrow at 7 p.m. And I know it's Saturday. So if you guys can make it, we're going to be doing these practice questions and putting all these clues together. All right. And if you can't make it, of course, replays are going to be in Camp Nursing School. I was dead as a dog last night, so I didn't even get to do the replay from last night. I will be doing that tonight. Replay from yesterday, replay from tonight. We'll be putting that in over the weekend into Camp Nursing School, along with, of course, the presentations, because you guys said you like it better when I also upload the presentations so you can have printed out. A lot of the stuff is summarized already for you in the workbook, but I know just some people just prefer having the presentation, so you have that as well. Okay. Really quick, as far as our scoreboard, tomorrow's the final day. Let's see who is in the lead for the scoreboard. Okay, so as of today, it is still the same. Raina, D'Amica, and Martisha. Hold on, let me go put back into share my screen. Right here. Raina, D'Amica, and Martisha. They are these are in the first 3 grand prize, first runner-up, second runner-up, or first, second place, third place. There's who in the lead so far. So congratulations to Raina, D'Amica, and Martisha. Again, the more you guys participate in Camp Nursing School, the more you answer the questions, the more you like comments, the more you're active in Camp Nursing School, the more points you get, in addition to coming to the lives and all this stuff. Now, at the end of day 5, I will announce the winner. Probably do that Sunday, but you'll have, again, till day 5 to do your clue check-ins, which is how you get more points. And obviously come to the live on tomorrow so you can really get as much points as you can and optimize all your points so that you can win these prizes. Okay. All right. So I will see you guys tomorrow at 7 p.m. Thank you so much for joining me tonight. Get some rest. I hope you guys had a great week. And I will see you tomorrow at 7 p.m. I'll see you tomorrow.